The
reality is, it is all over the world. We are in the middle of a pandemic, so there's no way to stop it once it has spread, and that is where we're. I have people who are EMS emergency workers who say, "Oh no, I'm strong, so I don't need to get the vaccine every year," and I say, wrong. You are the one, because you are the one spreading it. Somebody has a heart attack, you go take care of them, you take them to the hospital, and 3 days later, they die of influenza because you had it and you gave it to them.
What would be your role then in a major emergency? Say the next wave is very severe. What is your role in the county? What is your authority to do what? Like, could you quarantine and tell people to stay home?
As the public health officer for this county, I'm ultimately responsible for maintaining and preventing the disease spread in this community. So whatever I have to do to get that done, and I do with our commissioners. Actually, it is my responsibility, so I advise the commissioners, and just to make everything legal, we do it together. But right now, we are in the middle of what we call incident command, and actually are working with our regional incident management team, which involves a lot of the fire district people. And we have, and that's why I was a little late, because that was our meeting this morning. We meet every Monday. If it gets much more severe, we would be meeting more often.
Do you know that 4 people just died after taking a swine flu shot in Hungary and Sweden? And it comes at a time when the German government, this is now in the news, they're getting a different type of a shot without the preservatives as well as the German troops. So the general population is giving a particular type of shot, while the government officials are being given a certain type of shot without the preservatives. Also in New York State, half of the doctors and nurses are saying, based on tests they've done on the vaccine, they are not going to take it because they believe the shot is actually going to cause the virus to mutate. As a result, the healthcare workers in New York were told, you take the shot or you lose your job. And this was actually a couple of weeks ago. So I guess my question to you is, are you aware of some of the new headlines that are emerging from people in the medical field that are opposed to the CDC's recommendations?
Well, yes, I read the newspaper just like everybody else, and
Well, it's not all in the paper.
It's not all in the paper.
There's a lot of stuff that's not in the paper. And the internet's not all full of conspiracy theories. There's the AP and AFP in Europe that you got to do some really hard research to find out the story behind the story.
You know, I do get a couple of hundred emails a day, and I get them from citizens as well who send me the stuff that they read and research. So I do look at them, and I can't look at all of them.
Right.
I am aware of the ones from Europe, and I'm not the only one. There's 26 other health officials in Washington State who do the same kind of job that I do. Some of them are even much better than looking at the information that's out there.
Well, here's an article from Rasmussen, which is showing about the dangers of the vaccine from your local paper right here, and she's a former state representative as well. There's another article that came out that said they were going to lift the ban in Washington State on the amount of mercury they can put in the vaccine for the next 6 months, which other states haven't done. So there actually is no limit on the amount of mercury, which is now being linked to autism. And the latest rates are 1 in 91.
You know, we're not going to be able to debate the issue of mercury and autism. And I think that the important thing is people need to make their own choices. And the choice is, if you don't want to be protected, or if you want to be protected against influenza, there are mercury-free vaccine that is available. If you think that there is a conspiracy and you don't want to take any of the vaccine at all, it is your choice.
It's just that at the core of it, there are natural ways that they never talk about in the mainstream media that get all their promotions and advertising money from Big Pharma. Vitamin C, vitamin D, oil of oregano, olive leaf extract, all these things are really good for the immune system to boost it naturally, and they never seem to talk about those very basic things as a basic first measure to at least get your system healthy in terms of that. They don't really seem to talk about that in the news. It's just about the shots.
The one thing I do know is I don't like to talk about politics and medicine.
Amen.
Right.
And I don't have control over politics and
Do any of us?
government. But what I do know is based on what I know And what I am advising is if people do not want to get influenza, do not want to get H1N1, the H1N1 vaccine is available.
Yes, people are dying because of the flu.
Okay.
But years ago, 3 years ago, 5 years ago, same amount of people, if not more, we don't know. It's not statistically out there that 127 people died the last month because of. Well, how many people 3 years ago died? Now, the other thing is why is the push? There are people that die every month, and all of a sudden now, Safeway, $10 off your groceries if you get your immunization.
Right.
Why?
Well, that's a Safeway promotion. I mean, that has nothing to do with
But
health.
somebody has to give them the immunization that you can go to this store and you can line up and be there, and how do we
Seasonal
get...
influenza vaccine is a business.
How do we
Seasonal
get...
influenza vaccine is a business.
Ah,
People
okay.
buy it. Tim's over here buys the seasonal influenza vaccine and gives it out. Our health department had no budget. Normally, every year, we buy seasonal influenza vaccine to vaccinate our own staff and people at the county. I'm not here to sell vaccine. I'm here to sell protection. You need to protect yourself from getting influenza.
I'm concerned that the vaccine manufacturers have been granted basically 100% immunity in case anything goes wrong as a result of what might take place health-wise after they take the shot. The other thing is the World Health Organization, when you look at the people that are actually on the board of it, and they're the ones giving information to the CDC, it's basically run by Big Pharma. And so there's, I believe, a big conflict of interest. Is it morally right, being that this is a business, that the vaccines are actually a business, and it's been business for a long time? In terms of the numbers of how many people are dying as a result of taking the shots, we haven't, at least in my generation, been forced to take shots. We're reading articles now about them prepping the military to force inoculations on the public. Here's the key. Even though we're not getting into politics, it is related to other things going on in our country right now, because there are about 5 different reasons why they plan to quarantine major cities, including the city that I'm from, where I've reported on the story, in Portland, Oregon. Nobody comes in, nobody comes out. Terror attack, economic meltdown, vaccines, pandemics. How many different fears is the government throwing in our direction at this time? There's literally half a dozen to a dozen. Is there a reason there are so many things taking place as we go into the winter as they prepare for a dollar crash?
Yeah, and
it's
I
the odd
didn't
timing
realize
of
that this was going to turn into your audience.
No, that's all I have to
And
say.
You know,
I think he's right. I
well,
personally think he's
okay,
right.
that's fine.
If these
But what
people
we
would like me
need
to
is
leave, I
to
can do
let-
that. If
I
they're
don't
opposed to
want
what I
you to
just said.
leave, but I want you to share the time.
I just want to
And-
point that out so people
Okay.
understand that this is being discussed
Okay.
on the international level. This is not a small town issue. This is global. I mean, this is being discussed. It's good you guys are talking about this.
We
As
can't
long
do
as
anything
know.
about global, we can do something about small
One
towns.
thing we're trying to do in Thurston County is to not panic people. It's the worst thing that you can do.
Exactly.
And so,
The reality is, it is all over the world. We are in the middle of a pandemic. So there's no way to stop it once it has spread. And that is where we are.
There's evidence that suggests that when we take the shots, that's going to release a pandemic and it's causing mutation. They could say all these people are getting sick. I'm sorry to say that. I know that disturbs people and causes a panic. Unfortunately, half the doctors in New York agree with what I'm saying. And so when you have half the doctors in one area saying that we need to take a closer look at this.
Honestly, I believe myself more than that. So I really do not believe that you can.
I just feel you should hear that perspective. I'm done.
There is no way
It
that
just-
you can cause a mutation from a vaccine that you know, it just does not happen, okay?
okay, we have time for one, well, actually, our time is up. We have half an hour. Anyway, I want to thank you, Dr. You're very
Very good.
nice.
Yeah.
Real